Welcome, I'm Tatiana Darzi. After intense international pressure, the Chinese Communist Party has admitted to destroying samples of the CCP virus. They say it was for safety reasons. However, questions are being asked if the real motivation was to prevent investigations into the origin of the virus.
After facing huge pressure from the international community and considerable corroborative evidence, the Chinese Communist Party finally admitted to having destroyed samples of the virus, but argued that such action was done for lab safety. However, this belated admission is clearly not justified. The CCP continues to cover up and conceal the real number of people infected and the severity of the outbreak. One of the known facts about the CCP's cover-up of the disease is that it once demanded destruction of virus samples. The CCP has denied the action until recently. On May 15th, the Ombudsman of the National Health Commission, Liu Dengfeng, acknowledged for the first time that the Health Commission had issued relevant documents on January 3rd, arguing that the destruction of the virus samples was for laboratory biosafety.
At first, the CCP kept denying repeatedly, but now it has to admit because the international community has already gotten a hold of the evidence. There is no way around it. But now the CCP tries to justify its actions again.
Xing expressed that countries around the world will not believe in the CCP's deception because the destruction of the virus samples does not necessarily relate to the safety of the lab, but it certainly can prevent relevant investigations on the origin of the virus.
The real intent of the CCP's action is to cover up the origin of the virus and to circumvent the international community from sharing the virus samples and conducting investigations. In other words, the CCP is a crook trying to swindle the world. Now, the explanation it gives is no longer credible to the nations around the world, which means it cannot lie any longer.
A Radio France Internationale report asked, why did the National Health Commission of China come out so late to explain? This is still a riddle. If it is just for safety reasons, why has such important information been hidden until now? Soon after the epidemic broke out, rumors of the CCP destroying virus samples have been circulating among the public. Even China's media outlet Caixin directly disclosed in February that the Hubei Provincial Health Commission and the National Health Commission issued reports on January 1st and 3rd to require that, without approval and authorization, the relevant institutions shall not provide biological samples and related information to other institutions and individuals. Institutions and individuals who have obtained relevant biological samples from the relevant medical and health institutions should immediately destroy the samples on site or send them to the depository institution designated by the state for safekeeping. On April 20th, Taiwanese media obtained a copy of an inside document issued within the CCP, disclosing the fact that the National Health Commission of China once ordered the immediate destruction of virus samples. On May 1st, media overseas revealed that the Five Eyes Intelligence Alliance, which constitutes the US, Canada, the UK, Australia, and New Zealand, accused the CCP of destroying virus samples. Now, the Chinese National Health Commission has to unwillingly admit that it did destroy the samples of the virus. In order to save face, it says the action was to ensure lab safety, but this excuse does not explain the prohibition of disclosure of information relating to samples and the release of research papers and data to the outside world. Cheng Xiaorong, a column writer at the Epoch Times, wrote that this event clearly proves the CCP's constant lying, and it is only natural that people ask, besides this, what else has the CCP covered up? On May 9th and 10th, a number of new cases of the CCP virus were confirmed in Sanmin community in Wuhan. On May 11th, Wuhan authorities issued an urgent notice to conduct a 10-day citywide screening for nucleic acid. An anonymous Wuhan citizen said that the local government hastily emptied out patients from the mobile hospitals, ignoring the inaccuracy of the nucleic acid test results for the sake of political achievement, and this has been attributed to the potential outbreak of the virus.
After the mobile hospitals were closed by politicians, they released the people who tested negative for the test. But these people started to infect others after they got out. As a result, outbreaks like the one in Sanmen community broke out. When the epidemic was very severe at the beginning, community hospitals were allowed to issue death certificates. There was one community hospital in Wuhan that issued 3 death certificates in a day, and these indicated the cause of death was the Wuhan virus. It turned out that the hospital dean was called to the city where he was reprimanded. Since then, the way of issuing all death certificates has changed.
On May 13th, the U.S. outlet Foreign Policy exposed a data set collected by the Chinese military's National University of Defense Technology that covers at least 230 cities and 640,000 updates of information. Although the statistics are incomplete and the 640,000 points are not able to be confirmed as infectious cases, this number already far exceeds the 80,000 confirmed cases released by the government. This is evidence that the CCP has been covering up the epidemic.
President Trump's tweet accuses the Chinese regime of exploiting international organizations. Trump asked, "Why is it that China pays so little to international organizations like the WHO, the United Nations, and the World Trade Organization by claiming to be a developing country?"
The U.S.-China trade war seems to be on the verge of reigniting as a result of the pandemic. On the evening of May 16th, President Donald Trump sent out a tweet accusing the CCP of exploiting international organizations like the WHO for profit. The CCP virus that swept through the world destroyed Trump's economic miracle overnight. President Trump wrote on Twitter, "Why is it that China, for decades, and with a population much bigger than ours, is paying a tiny fraction of dollars to the World Health Organization, the United Nations, and worst of all, the World Trade Organization, where they are considered a so-called developing country and are therefore given massive advantages over the United States and everyone else? Prior to the plague floating in from China, our economy was blowing everybody away, the best of any country ever. We will be there again, and soon." In addition to the WHO, Trump also mentioned the preferential treatment the WTO gave the CCP, drawing public attention to what the Trump administration might do to China next. Previously, the Trump administration accused the WHO of failing to do its job by releasing false information provided by the CCP and therefore causing a global pandemic. Trump announced last month that the U.S. would suspend funding to the World Health Organization. Responding to reports that the U.S. plans to restore partial funding to the WHO, Trump said that reducing 90% of funding previously given to the WHO is just one of the numerous options being considered, and no final decision has yet been made. The United States is the largest funder of the World Health Organization and contributes between $400 million and $500 million per year to it.
California Governor Gavin Newsom placed a $1 billion mask order in April with BYD Company, a Chinese car manufacturer with locations in Shenzhen and Changsha in China. According to the National Institution for Occupational Safety and Health, the N95 masks produced by BYD failed to pass inspection.
The National Institute for Occupational Safety and Health, NIOSH, announced that N95 masks produced by Chinese car manufacturer BYD failed to pass an inspection, and that BYD has been denied approval. The decision will have a significant impact on BYD's $1 billion mask deal with the state of California. The federal regulator said after an investigation that BYD's factories in Shenzhen and Changsha, China, were in non-acceptable states and declined to give specific reasons as to why the masks were denied approval. In early April, California Governor Gavin Newsom placed a $1 billion mask order with BYD, demanding a monthly supply of 150 million N95 masks and 50 million medical masks, with a deposit of nearly 500 million. The deal has raised substantial concerns with the public. The company must return nearly $250 million to California, since delays in getting federal certification prevented it from providing the N95 masks on time. So far, the FDA has revoked authorization for more than 60 Chinese mask manufacturers. Only 14 remaining Chinese companies are still allowed to export masks to the United States.
A woman in Wuhan who lost her husband to the CCP virus also contracted the virus herself, leaving one of her lungs impaired. She has a son in high school, but they haven't received any financial support to help pay medical bills or reduce some of her son's tuition fees.
The cover-up of the CCP virus outbreak in Wuhan saw many residents lose their loved ones. Many families have been traumatized both emotionally and financially. Ms. Wang's husband died from the CCP virus. She also contracted the virus herself. She is now disabled with a damaged lung and a teenage son who would not reveal his pain to her. Still mourning the death of her husband, she carries the financial burden on her own, and governmental help is nowhere to be found.
I have expressed my needs to local officials, but they say they can't do anything about it. It's just me taking care of my son now. Now my husband is gone, so is our financial support. My son is going to high school this year. It's rather difficult for me to handle it all by myself.
Could you talk about how your husband was diagnosed?
He was hospitalized on January 12th. At first they said it's not contagious, but then they said he had to be transferred to the infectious disease unit. He suffered with a fever for days. On January 27th, he was transferred to the ICU. The next day, I was sent to the quarantine site. 2 days later, I felt I wasn't quite right, so I went to the hospital and they told me I had a lung infection. They didn't specify what type of infection it was.
Were you at the quarantine site this whole time?
Yes. After I got out of the hospital, I was in quarantine for 14 days, and then another 14 days of isolation after I got home. They kept me isolated for months.
When did your husband pass away? How did they notify you?
By phone. I couldn't go. I was not allowed to leave the quarantine site. He was sent directly to the funeral home. I wasn't allowed to see him. They won't let me get his remains either. I was isolated at the hotel. Nothing was allowed. I wasn't even allowed to go to my husband's funeral. I totally collapsed. I called our local cadre leaders. I cried, I begged, but it's all useless. They wouldn't allow it.
Did your husband say anything before he passed away?
No. I asked the doctor. The doctor said he was intubated so he couldn't talk.
Now that your husband is gone and you are out of quarantine, what will you do?
I can't do anything. I'm not completely recovered. Now I rely on traditional Chinese medicine at my own cost. I take the Chinese herbal medicine every day.
Have you talked to the local officials about your situation and the help you'd like to get?
Financially, they can't do anything about it. They provided 3,000 yuan, $423.13 USD, subsidy for the funeral. Nothing else in terms of money. I asked for some financial support from the district officials. They said financially I am not qualified. I retired at the end of 2019. I received 2,000 yuan, $282.08 USD, of retirement payment. That exceeds the standard for any subsidy. But I told them I am on my own. I have to pay for my Chinese medicine, and I have a son going to high school. If anyone can provide some relief, that will help. They said no, and that's the government's regulation. We need some help financially. I can't do anything with my damaged lung. What can I do? No one will accept me as a worker. There's also my son's tuition. If they can provide something substantial, such as at least half of the tuition, I won't ask for waiving the entire tuition, but at least half.
The interview was conducted on May 9th by Xiaohua Gu of the Chinese language Epoch Times.
Joshua Phillip, the host for Crossroads, talks about a resolution proposed by 62 nations to the World Health Organization regarding an investigation into the origin of the CCP virus. However, in order for the resolution to go through, they had to remove any mention that the CCP virus may have come from China, which is what the Chinese Communist Party has been calling for.
So first off, 62 nations, including Australia, are backing an EU-led resolution calling for a probe into the origins of the virus. We've been talking about this for a bit, that Australia was calling up different countries, trying to get them to sign on to this investigation. Well, there have been some changes to the initial proposal, although it is now apparently going through. So hear me out on this. The devil's in the details. Now, this resolution will be submitted this week to the WHO Assembly, the World Health Organization Assembly. The diplomatic breakthrough has come with a price. All references to China, the epicenter of the original outbreak, have been stripped from the motion. There's even hopes that China could back the probe because it has been framed without reference to how and where the virus originated. So, in other words, in order to get all the countries to sign on to this, they have 62 countries, they had to remove the idea that it may have come from China from the proposal for the investigation. In other words, now if this investigation goes through, it will not necessarily limit its investigations into a China origin, which is what the Chinese regime has been calling for, notably. And it calls for an impartial, independent, and comprehensive evaluation, but would have the WHO assembly to establish this. But notably, this is being presented as also an investigation into the WHO. So it is unlikely that the WHO itself, at least in my analysis and what I understand of this, unlikely the WHO itself will be the one forming the investigation. Very likely this will be done by member states. It's not stated too clearly, to be honest. But notably, this is a quote. It says it will, quote, review experience gained and lessons learned from the WHO coordinated international health response to COVID-19. Now, author and commentator Brahma Chalani wrote this on Twitter. He said, quote, Australia, India, Japan, China's partner Russia, and 58 other nations will jointly move a resolution at the WHO Assembly tomorrow demanding an early, quote, impartial, independent, and comprehensive inquiry into the pandemic, including the WHO's actions. And so we'll have to see how involved the WHO is in this investigation into itself, because this is being presented to the WHO Assembly. We'll also have to see whether this will be a fair investigation, because notably the Chinese regime has been backing a WHO investigation.
The following charts show you the most recent numbers regarding the CCP virus pandemic. The Chinese Communist Party's cover-up led to a pandemic that now threatens the lives of people around the globe. With over 4.9 million people infected, China is still defensive about independent international inquiry into the origin and spread of the CCP virus. The Epoch Times has initiated a global Sign the Petition campaign calling for investigating, condemning, and rejecting the CCP. We believe that investigating and exposing the truth is the only way that we can remain safe. Let's take action. Sign the petition at ccpvirustruth.com. That's all for today. Don't forget to like, subscribe, and share this program with friends and family to keep them informed about the latest news and updates. Thank you for joining me. See you next time.